no matter what.
Good morning.
Good morning.
How are you doing, Miss Smith?
I'm doing fine. How are you?
I'm good. It's a pleasure to see you again. You so bubbly.
Because I'm so happy to be here. I'm so
That's
ready to
good. That's
start.
good. I'm sorry, but I do have to ask you these questions. Do you feel like harming yourself or any one of your friends, anybody else?
Nope, I'm not suicidal or homicidal, no.
Okay, that's good. How have you been since the last time I saw you?
So last time I saw you, we went through all those questions and you were asking me, was I ready to change? And when you were asking me the questions, I wasn't sure, but I was saying yes because I'm like, of course, this is what she wants me to say. I'm ready to change. But I went home and I was like, is this a big problem, my drinking? Like, is it really influencing my everyday life? Is it, taking a toll on my family? And when I thought about it, I said, I am ready to change. I'm just tired of alcohol controlling my life. Like, I'm tired of going to the store to buy alcohol, spending all my money, not having enough money, and, having my friends worry about me that I may get sick. So I feel like my mindset is different since we talked. I'm still drinking as much.
Okay.
Okay, I'm still drinking.
Okay, we'll work on that.
Yeah.
Okay, do you have any, before we get started with your treatment plan, do you have any questions or concerns for me?
Um, I guess my only question is like, is this treatment or this us meeting or whatever, is it going to have a huge demand on my life? Like, am I going to have to meet every day?
No, it's not going to have a huge demand on your life, but it's going to help you. I'm going to put you in some classes and programs where they could give you help. You know, you could you'll be meeting people that's going through the same thing you're going through in your group, like in your AA. I'm going to refer you to AA
Okay.
to go to your meetings, and they'll help you. Along with them, you'll meet a family that they're all trying to stay absent away from alcohol, and so you'll meet a whole new family.
Okay.
And but first, before I start our treatment program, I wanted to first go over you with your tests that I had you take in the intake, your first intake when you answered the questions, when you
Mm-hmm.
answered the CIWR, the score that you received,
Mm-hmm.
um, it caused you to be moderate. You're moderate
Okay.
alcohol. That's how I got your diagnosis when you answered the audit C questionnaire.
Mm-hmm.
You had a 4 out of 5, and also with the eighth SAM criteria, I you scored like 8, like 10 on your CIWA. AR
Mm-hmm.
score was 10, and so that's moderate.
Okay. And 4 out of 5 was moderate too.
Yes, it
Okay.
is. So that's how you got that diagnosis.
What's my diagnosis?
Alcohol use disorder.
Oh, okay.
And because your DMS, you had 11 symptoms on the DSM, how
Mhm.
the criteria, how they score
Mhm.
for people who have take alcohol. You scored 4 to 5, and that is moderate. Um, you had 11 symptoms. Out of 11 symptoms, you had 5 of them.
Okay. Yeah. I
So
mean,
that's how.
I agree with that diagnosis. I did drink a lot, so.
Okay. All right. Well, actually, I want to talk about the first thing I want to do is I want to get you into withdrawal management. I want to get you clean. I want to get you to refrain from using the alcohol. The
Completely.
25, right, out of the 25, out of the 30 days, 25 days, I want you to completely, refrain from using the alcohol. If this is something that you would like to do as well.
I don't. I don't think I can go from drinking almost every day to not drinking at all. Like, I think that would be really hard, but I definitely can slow down. Like, I drink 25 days out of 30, so I can see me maybe drinking like 10 days out of 30 or like 15 days out of 30, but I can't completely give it up.
Okay, well, what about, would you be willing to go into a withdrawal management?
Hmm.
Okay,
Yeah,
for 30 days you would be?
yeah, I can go
Okay,
there. Yeah.
well, I'm going to start you off with withdrawal management. That'll be the first thing I want to do is get you get detox.
Okay.
with withdrawal management. And then, as I'm looking over your ASAP criteria, I see that you've had problems with your family. Your mother died when you were 18 years old, and you were raised by your grandparents, and they were alcoholics. So it seemed like alcohol played a big part of your life. You said your uncles and your aunties, you always, all your thing you could think about them is them drinking all the time.
Hmm.
And so, you saying that you pick up the alcohol because that's what you see it on a daily basis.
Yeah, that's all my family does. Like, if someone passes away, or if someone is sad, or if we're celebrating, it doesn't matter what it is. My family drinks. Like, that's what I witnessed. If someone just graduated, oh, let's get a bottle. My mom passed away, oh, let's drink our sadness away. Or I don't. It's just like we just drink, and so that's
But
how I started drinking because I seen my family like that was their answer to everything. I felt like alcohol was going to answer all of my questions and make me just happy.
Well, that's going to change for you now. I'm going to make sure that I refer you to some programs where things will be a little different. I'm going to refer you to behavior therapy and then maybe some family counseling so you can learn how to um, live life without the influence of alcohol. And then all the things that you learn in your groups and in these programs, you could take it back to your family, and you could be the one who help your family out. In the future, you could show them some other techniques and some other things to do besides everybody gather around and drinking. So I'm going to also refer you for behavior therapy, and then some family counseling. I think that would be good for you as well, since all your family drinks with you, and so now you're gonna have a new behavior. You're gonna want to not drink anymore, and so I want them to be a part of your recovery and everything. I want them to, help you out with that. So I think family counseling will also be good for you in your treatment plan.
Hmm.
Okay. Do you have any questions or anything you would like to ask me?
Um, so with the detox center, is it like that thing that I see on TV where it's 1 day of detox, or are you trying to get me into an inpatient facility?
No. Well, actually, since you scored low, um, I think you will could function without going into an inpatient um, detox center. Um, and what they'll probably do is if you get uncomfortable while you're detoxing, they have medicine that they could give you. They'll probably put you on some medicine. Um, but during that time while you're there, every 3 days, that will you'll be getting monitored. And then if you get sick, that they will give you. The doctor will prescribe you some medicine. If you get nauseated or however it goes.
Okay,
You
because I
know.
can't do inpatient. I'm trying to find a job.
Okay, well, you qualify for outpatient. You qualify for outpatient. I think
Hmm.
you would work well with outpatient. You're determined. You're strong. You're motivated and everything. And I know that you're gonna go to school. You told me you would like to go to school and be a cosmetologist. I know you'll be able to do that and
Hmm.
find the man of your dreams and everything, and have the
Yeah, I
son
just
or
want a
daughter
normal life. Yeah.
that you always wanted.
I just want a normal life.
And I'm happy for you, and I want that for you as well. Okay, so now we have you going. You're going to get detox first, and then I'm going to refer you for some behavior therapy. Um, I think also family counseling will be good for you, and then for a self help group, I'm going to refer you to Alcoholic Anonymous. This is going to be your home group, Alcoholic Anonymous,
Okay.
and
Can we hold off on the family counseling though?
you want to hold off on this.
Yeah, I don't want to get my
Okay.
family involved. I want to work on me first.
Okay.
Yeah, and just be strong
That's
enough to
that's
help
fine. There's
them.
no problem. At a later time,
Hmm.
after I work with you, our time frame for your the beginning of your treatment is these gonna be the first. This is gonna be your first 30 days. Your first 30 days,
Hmm.
you're gonna get detox. You're gonna get clean and sober.
Hmm.
Then you will be able to think better, and you'll be able to know what exactly what it is you want to do. And then in 30 days after you complete, have some behavior therapy classes, then you'll be more focused and you can know what your triggers are, what your problems are, what your issues are, what it is you need to work with,
Mhm.
and everything. And so, family counts, we're not going to worry about that now. We're going to keep the focus on you right now since this is your beginning. You'll be going in.
Mhm.
Okay, and then for AA, I'm going to recommend that you go to AA like I'll say three times out of a week. And the first thing I want you to do is get you a sponsor. When you start going to me, they're going to ask you to get a sponsor because um, when you first start withdrawing from alcohol, you're going to want to be around some people who has been there before you, have paved the way. And so I think Alcoholic Anonymous will give you the platform that you need to stay sober. You'll get a sponsor
Mhm.
and everything. The sponsor will make sure you get to and from the meetings.
Okay.
Your sponsor will call you to check on you
Mhm.
to make sure you're doing the things that you need to do to stay sober and carrying on. You still be able to work your job. You know that you work at the hair store.
Mhm.
You know that won't change for you. You'll just be um,
Plus, I'm looking for another job. Um,
okay. That's
yeah,
good,
because I need more money to pay for school and stuff. So.
right? And then afterwards, when you complete um, your outpatient treatment, I'm going to give you a referral to Tri-C so they can help you with your financial aid, and then you could apply for school so you could become the cosmetologist that you want to be. That I know you could be.
Mhm.
That I see this inside of you. You could do that. Um, but here, I wanted to show you a copy of your disorder. I wanted you to read over that as well and everything, so you'll know for yourself
Okay. Yeah,
um,
I
what
can
what
read
what
it
what
too.
it involves in.
Yeah.
Okay.
Thank you so much for giving me this too.
Yes, because I want you to know what it is, what it does to you, what alcohol does to you when you drink it. So you won't want to drink anymore.
Okay.
Um,
That's really nice. Thank you.
your strength, you know what? I can see how caring and how strong you are, and
Mhm.
I myself, I am so motivated for you, and I'm so grateful. I know that you can do this. I know that you can complete this program, your treatment program. I know you can complete it. And I know you can become the hairstylist because I need my hair did right now. So I can come and let you hook my hair out for me. I know you can do this
I'm
for
doing
me.
it at home. I'm just not in a shop yet.
Yeah, okay, okay. I like that.
So
Um, do you feel that the diagnosis is right? Do you feel that you have an alcohol use disorder?
I do. Yeah. Like I said, I mean, I know that it's a problem, and after talking to you, after that assessment, I mean, I trust you. You know, I agree. I have a problem, and I need to treat it.
Okay, I
So.
think this outpatient treatment, I think it's gonna go well for you. Um, I want you to always know that I'm only a phone call away. I'll be a cheerleader for you in this process, and I want you to know that at any time that you having a problem or anything, that you always can feel free to give me a call. Um, let's
So.
see.
So I'm sorry.
Go ahead.
So like I know that you've been telling me that um you can see like a lot of strengths in me, or like
Yes.
I have a lot of strengths. And so I just wanted to let you know, like, on my way over here, I was thinking, like, what are some of my strengths? Like, what can I do well? And it was really difficult for me to identify them. And so, like, what I came up with is, I feel like that I'm very determined because, like, even though I lost my mom, and even though, like, I was shot, you know what I mean? Like, I still want to go to school. I still want to be a better person. Like, I still want to make my mom proud and go to school and just open up a hair shop one day. Like, it's so much I want to do that I feel like I can do. So I feel like I am determined. Like, I didn't give up. I didn't let that stop me. Like, I could have got lazy. I could have stayed home and just gave up, and I didn't. And then another one, I feel like is that like even though it's hard for me to get to work and stuff, like I always get to work on time. Like I'm on time, and I feel like that takes you a lot of places because people don't like when people waste their time. So showing up for work late, I could have got fired. Showing up to this appointment late, you could have like had to reschedule me. And it's just I feel like being on time is one of my strengths because yeah, like I feel like you get a lot of places being on
I
time.
think that's excellent because you know what? Because you're showing that you're there. You're ready.
Yeah, like
You're
I
willing and
care.
you're ready. Yes, you do. And
Yeah.
I don't have a problem with you. I know beyond a shadow of a doubt that you're going to make it. You're going to make it. You're going to be there. Deborah's Salon. I see it already in lights. Deborah Salon. And
I
I'll be
can
like,
see
hey,
it. I
now,
can see
yes.
it. So yeah, I don't know. I'm just happy, that you see that in me because sometimes it's hard to see stuff in yourself. Sometimes it's hard for people to understand what you're going through or see you as a strong person, and it's hard sometimes for me to see myself as a strong person. So when you kept,
But
pointing
you're
that
doing an
out,
excellent job, and I'm very proud of you. And I have no doubt that you're going to
yeah.
graduate from your program. You're going to finish the detox program. You're going
Hmm.
to do good with your therapist. This is going to be your behavior therapy is going to be a continued thing, something that you're going to continue to do. You know, I'm
Hmm.
going to monitor you in the first 90 days, and I'm going to see after the 90 days if
Hmm.
do you still need it, and then maybe I could start. Maybe after the 90 days, after you get where you need to be, maybe you'll be willing to have family counseling. But I'm not going to worry about that. And
Hmm.
then with the AA meetings, I know that in our next session, you will have had you a sponsor,
Hmm.
and your sponsor will be very meaningful to you and very helpful to you, helping you with your meetings and everything. And
Hmm.
life is going to be totally different from you now because you're gonna have to find some things to do, besides drinking alcohol.
Yeah.
Once you go to work and then you come home. Um, but now that you have these classes to go to, it'll be different for you. So you're gonna probably be tired and wore out from going back and forth to group and to classes, and so that'll be good for you. That'll keep you on the right track. And and AA, they have other things to do. They have in the summer months they have picnics and then they have parties and at the parties everybody always get so focused on drinking. They have fruit punch and apple cider and
Hmm.
and everything. And so I think that once you once you get detox and start going to your counseling and therapy, that your life will turn into something that you never thought it could be. It was going to be very good for you. And I'm your cheerleader. I'm on the sideline cheering you on. I'm on the sideline cheering you on.
So basically, just to kind of get like a clear outline and understanding, um, what is like, we have all these goals, and I just want to make sure that like, what is my long term goal? Like all of these are kind of short term, like
Right.
AA meetings and all that. So like my long term goal would just be to get sober, right?
Continue to stay sober.
Yeah, yeah,
Continue to stay sober.
okay.
That's yeah. Continue to stay sober.
Yeah, yeah. So with my goal, sort of just like continue to stay sober beyond the 30 days, the 90 days.
Right. You're going to take
Uh-huh.
this, guess what? We say in AA, it's going to be one day at a time. You're
Hmm.
going to stay sober one day at a time.
Right.
That's how you're going to do this. You're going to do this one day at a time,
Okay.
and so, and everything.
So then my short term goals is that basically I will go to a detox center.
Yes.
Okay.
Yes.
I will go to a detox center
Yes.
and I will complete detox
In the 30
within the
days,
30
30
days.
days.
Okay. And so then my second short term goal is basically to like um,
You
go to at least one session of
have
behavioral
your
health,
therapist.
just
Yes.
one session within the 30 days.
Yes,
So
within
just
the
to
30
get set up with
days.
that and at
Yes.
least go to one session.
Yes.
Okay, yeah, I can do that within the 30 days, go to one session.
Mm-hmm.
And then, so within the 90 days, then you would want me to have like 3 sessions, so like one session a month maybe?
For the behavior therapy.
Yeah, for the
In the
behavior
90
therapy.
days, I would like you to have like once a month.
Yeah, that's good.
Yeah.
Yeah, okay. Okay. And then another short term goal is to go to find a
AA.
sponsor.
Yes, AA. I want you to start going to AA.
Okay.
Yeah, AA. And
Okay.
that's attainable. And you can start going to AA in the 30 days. I would like you to go 3 times a week because that's where you're going to find all the people that's clean and sober.
Yeah.
That's where you're going to find all your friends. That's going to be your second home. The
Okay.
Alcoholic Anonymous is going to be your second
Because I know
home.
I'm not going to find a sponsor right off the
No,
bat.
you're not.
So going 3 times a week,
Right.
that's fine. But then you want me to have a sponsor within the 30
Within the
days.
30 days.
Okay, yeah, hopefully I can find one. That's definitely reasonable. And so what about like, so what would my start date be?
Okay, your start date is going to be today because when I
So 11.
finish this session with you,
Mm-hmm.
I'm going to call and I'm going to um, get you in to start your detox.
Okay.
So you can start your detox today. You can start your detox. And um,
So 11/27.
yes, 11/27, 8. And then I'm going to see you again every week, once a week.
Well, I mean, I don't mind. You know, like you said, you want to check on me every 30 days. That's fine.
Yeah,
Yeah,
but
I can.
I'll probably check on you every 90 days.
Every 90? Okay.
Days, yeah.
So next time we'll meet us somewhere in like
Yes.
February 27th?
Yes, February the 27th.
Okay. Yeah, yeah. And so then I should probably have all this done. I mean, well, try to have all this done
Well, how do you feel
in
about it? How do
February.
you feel about
So I'm thinking maybe we can change one of my short-term goals.
it? Okay.
And so hopefully after the detox, I'm not like the withdrawal management that you're setting me up with. Hopefully I'm not like still wanting to drink a lot. But I think one of my short-term goals should probably be like to decrease my drinking by 2 glasses every other day within like the first month. That'll be so good.
Okay. Okay.
What do you think?
I think that sounds good.
Okay, yeah, because I feel like that's something I want to do. And then, like, I know that, like, the other goals are fine. I like those. But I wanted to set a goal, like, pertaining to signing up for school, but I guess that I
Right.
can't
You
do
know
that
what?
because
Okay.
it's kind of for my.
After you know what? While you're in outpatient treatment, while you're doing your behavior therapy and your AA meetings, within the 90 days after you complete the 90 days, your next phase, I'm going to give you a referral to Tri-C to
Okay.
do your financial aid.
Yeah, you're
Because
right.
after
Because
you get
to
the
have
90
so much
days,
coming up
yes,
at me,
I don't
yeah.
want, I want you to get well first. I want you to take your time and get sober, get the alcohol out of your system. I
Yeah.
already see you're strong, your strength, your mind, you're determined. So I
Mhm.
know that you're going to complete what it is you want to do. After you complete the 90 days, then I'm going to do a referral for you to go to Tri-C so you can start your financial aid
Mhm.
and get your FAFSA so you can apply for school. You can apply for your
Yeah.
money for school.
Okay.
Yeah, that's that. I definitely want you to do that because that's your goal. That's what you really want. You want to complete school. You
Mhm.
want to get sober. That's what you want to do.
Get
And so I
sober
want you to do
and
that.
yep, open up my own salon one day.
Yes, and so
Okay.
I'm gonna yeah after you do the 90 days, then I'll be ready to give you the referral for your financial aid. You'll be ready to start school because then after 90 days you should be very well adjusted. You should feel awesome.
Mhm.
You'll be done had at least three behavior therapy classes. You've
Mhm.
been to have several meetings at AA, and you'd have been did the 30-day detox. So you'll be looking very good when it comes time to sign up for school. And then once you sign up for school, your meetings will be less. because school going to take up a lot of your time once you
Yeah.
start your studies. And
Yeah.
once you get into your studies, then life is going to be different for you because you're going to be happy. You're going to be doing the things that you want to do.
Mhm.
You're gonna continue to be motivated. You're gonna be doing what it is you want to do.
Yeah.
When you're gonna be looking for your end of your study, you're gonna be looking for your end. So I think everything is gonna go good for you once you complete your first 90 days.
Okay.
Okay, it's something that she wanted us to do at the end. How do we know how many minutes we've been? Okay, I can see.
25.
Yeah. Okay, now, um, is there anything else you want to discuss? You you like you consent with your treatment plan?
Yeah.
You agree with your
Yeah.
treatment plan?
I'm
Okay,
really
well if you
thankful.
agree with it, I'm gonna need your signature right here. Could you sign this for me?
Sure. I just really want to thank you because you let me, be a part of this process. Like, it's not like you just came in here and you said, this is what you're going to do, and you need to do it. You let me say, hey, this is what I want to do. Is that
When you
okay?
told me what you wanted to do,
Yeah.
I looked, I did some research and found some places that I feel that you would, enjoy being in. It would be
Mhm.
good for you and everything
Mhm.
because I see the stars in your eyes and I feel that you're going to be an awesome candidate for the newest salon that we're going to have in the city of Cleveland, Deborah
Yeah.
Salon. I told you I still see the lights. I still see the lights.
Yeah.
But before I end my session with you, I still want you to know that even if you fall back, if you backslide, if you take a drink or two, I want to make sure that I give you some crisis information. I want to give some information to you
Okay.
for some places that you could go to and
Mhm.
everything. I want to give you this number that you could always call for help
Okay.
all the time, anytime, 24 hours of the day. You make
Okay.
sure you call this number because I don't want anything to happen to you, Miss Deborah Snow.
Thank you. Thank you. So yeah, so like anytime I can't reach you and I feel like I'm about to
Yes, yes. If you feel
relapse,
like you're your wits in
call
and
this number.
everything, yes,
Okay.
yes. I want you to
Yeah.
do that
Okay. Thank you.
and everything.
I'm glad you gave me this number because knowing that they're available
That makes
anytime,
a yeah. That makes a
24/7,
it makes a
that's
big
good because I
difference.
might have problems at 4 o'clock in the morning. You're gonna be home asleep. So, so thank you. I'm so happy
I
and
know. I am just so
excited.
excited for you.
Yeah.
I really am.
Yeah.
I am so very excited for you.
So
Uh,
so our next session is
it's gonna be in 90 days, and that's gonna be like cause this is gonna be February 27th,
okay.
around that time, and um. I want you to know that I recommend it for your level of care. You're gonna do outpatient. You're gonna
Mhm.
do outpatient treatment
Mhm.
um, for 30 days,
Mhm.
and I wrote your response. Your response was, "I am determined to complete school and have a family sober."
Okay.
And
Sounds like me.
and what do you want to have? What do you want your first kid to be, a girl or boy?
Whatever. Just give me one. I don't care. Yeah. So, thank you for this session, and it was really helpful. And I'm gonna go home. I'm gonna read this about my diagnosis.
Okay.
So, thank you. And
That's what I want you to do when you get ready to take that drink and just get obnoxious. Read about it,
yeah,
and then it'll turn your mind. You got to just learn how to um, do some other things um, like I like cards, puzzles. Find you a good movie.
yeah. Find a different coping skill.
Yeah,
Yeah. Okay.
yeah.
All right. Well, thank you.
You welcome, and I just wish you the best. I'm just so happy and so pleased that everything turned out was going to turn out good for you.
Mhm.
And so, in 90 days, I'm going to be looking for you. We make an appointment to see you.
All right.
Okay.
Yes.
All right. You take care.
Thank you so
Okay.
much.
Don't forget the crisis number if you need it.
Okay.
All right.
All right.
Okay.
Bye.
Bye bye.